Hello, I'm Bob Holden, Governor of the state of Missouri. Over the past year, the 16 states and 2 territories that are members of the Southern Governors Association have been working on promoting an interstate model that uses existing telehealth networks. This telemedicine and conferencing capability will enable immediate communication among the SGA states, the Center for Disease Control and Prevention, and attending health professionals as part of our response to a public health emergency. The following will demonstrate the communication capability between the 4 states of Missouri, Kentucky, Virginia, and Florida. We will utilize actual telemedicine capability, demonstrate key activities that would be employed by affected states, and provide narrative explanation of public health activities that would be occurring simultaneously. I want to thank everyone who has participated in this very important telemedicine project.
The National High School Legislative Debate Club finals are being held at a high school in St. Louis. There are 4 schools left in the competition from Missouri, Kentucky, Virginia, and Florida. The West Plains, Missouri Zizzers are the favorites to win. However, one important team member becomes ill with fever, malaise, headache, and body aches 4 days prior to the finals. Although she is not feeling well, she vigorously pleads with her parents to let her attend the debate, and they agree. On the first day of the debate final, the student is noticed to have a papular rash on her face and arms. The father of a student on a competing team is a physician and is asked to give an opinion of the rash. He declares it is definitely chickenpox and suggests the student be sent home. The rash is worse on the next day and the student feels worse. Her parents take her to the Southern Missouri Community Health Center in West Plains, Missouri to be examined.
Let me check your pulses. And can we look at this rash again that you have here?
The student's primary care doctor conducts an examination in person, and having never seen a rash like this, decides to ask for an urgent teledermatology consultation.
I have a patient in the clinic that has dermatological findings that I'm very concerned about.
Dr. Karen Edison, chair of dermatology at the University of Missouri, sees the patient via the Missouri Telehealth network.
My goodness.
And Dr. Edison, she has these on her other extremity, on her front chest, on her neck, face, and all the way down her back as well.
Wow. And does she have any lesions in her mouth?
She has a few in her mouth as well. They're kind of faint.
Okay. All right.
During the consultation, Dr. Edison becomes increasingly concerned about what she is seeing and pages the on-call infectious disease physician to her telehealth suite. Dr. Edison also asks that digital images of the rash be taken by appropriately protected healthcare personnel and sent to her via password-protected email. Upon consultation with all the attending physicians, they suspect the student may have smallpox. The patient is immediately isolated to a negative pressure room, and all the staff who had unprotected contact with the patient are quarantined. Dr. Edison then contacts the Missouri Department of Health and Senior Services regarding the suspicion that this student has smallpox.
We have a 17-year-old white female Dr. Tracy's here with me, and we have a very high index of suspicion that she may actually have smallpox.
Once the State Health Department discusses the suspected diagnosis with Dr. Edison, the department begins the implementation of established public health protocols for laboratory confirmation and testing plans in Missouri, alerting the CDC, which includes referencing the rash algorithm poster as a diagnostic tool, activating disease investigation and surveillance protocols, informing public information officers in the State Health Department, State Emergency Management Agency, and Governor's Office, activating the Public Information Plan and begin developing messages, and initiating a video conference with DHSS, CDC, and Dr. Edison, the attending physician, via the Missouri Telehealth network.
What's the actual distribution of the rash?
Well, the most striking thing about it is its monomorphous nature. As you know, many of the other pox viral infections aren't quite so monomorphous, and these lesions are absolutely identical, and that's really why I began to think about smallpox. It's centrifugal. It's mostly, trunk and proximal extremities, but it's already beginning to spread, and I'm really quite concerned.
Missouri, following a predetermined protocol, declares a statewide public health emergency. This emergency declaration initiates activation of the state's Emergency Operations Center and plan, including federal emergency interaction. Simultaneously, the CDC briefs the White House and appropriate presidential declarations are being prepared. The Missouri Department of Health and Senior Services requests that the Missouri Telehealth Network organize a multi-state video conferencing connection with the CDC and the states of Kentucky, Virginia, and Florida to brief them on what has occurred in Missouri and to alert them to the fact that the West Plains student had contact with students from their respective states. During the video conference between the states and the CDC, all relevant information is shared and a plan is developed regarding a public health approach to containing this potential outbreak. On this call are the governors of the respective states, public health leadership, state emergency management leadership, Homeland Security leadership, university-based physician experts, telehealth network directors, and other appropriate staff. The technology provides a mechanism for these states to share information and formulate plans in real time.
I want to welcome all of you to this Telehealth Network video conference. We will discuss both the actions being taken in Missouri and the next steps for a multi-state approach to the management of this issue. Missouri has strong public health, public-private, and academic partnerships. These partnerships, along with functional systems such as our telehealth network, all work together to serve and protect our citizens. In situations such as the deliberate introduction of disease into our state, Missourians can be assured that their public and private health care systems have the ability to respond rapidly and appropriately.
Well, thank you, Governor Holt. An excellent demonstration of how your state would respond to this type of public health emergency. And with me today is part of my senior leadership team who would assist me in responding to a bioterrorism event. With me is Dr. James Holstinger, Secretary, Cabinet of Health and Family Services, Dr. Rice Leach, a Commissioner for the Department of Public Health, General Donald Storm, Adjutant General, Kentucky National Guard, Erwin Roberts, Director of the Office of Homeland Security, Commissioner Mark Miller, Kentucky State Police, Malcolm Franklin, Director of the Kentucky Emergency Management. The steps taken by your staff mirror those in our plans, and Kentucky's response would be very similar. In fact, immediately after this teleconference, Dr. Holsinger, Dr. Leach, and others are going to teleconference with the Director of Local Health Department and his staff to stimulate the actions that would be taken, assuming the high school debate team involved in this scenario came from their community. Since the community is in South Central Kentucky, the teleconference will also connect to the University of Kentucky, where infectious disease specialists will be available for clinical consultants if needed by the local physicians. Let me close by commenting on the technology we're using today for this demonstration. During the past 10 years, Kentucky has leveraged funds from federal, state, and private sources to develop a statewide network of telehealth sites based at hospitals from Pikeville to Paducah. Last year, we contracted with 18 of these telehealth sites distributed across the state to make their equipment available for emergency teleconferencing on a 24/7 basis. We call the network PROACT. Fortunately, we have not had to use it for a real event yet, but we have tested it twice. Last September, we connected from a tabletop bioterrorism exercise in western Kentucky to studios in a local hospital, the Emergency Operations Center in Frankfort, the Emergency Operations Center at the CDC, and also with your Department of Public Health. The scenario was near your border. Last December, we did a similar exercise in eastern Kentucky and broadcast from Hazard to Frankfort, the Departments for Public Health in Virginia and Tennessee, as well as the Emergency Operations Center at the CDC. Today's exercise has been another demonstration of the application of existing telehealth technology to expand on the way we can communicate in an emergency situation. This scenario has given us an opportunity to practice what we would do in a real event, and I congratulate you on an excellent production.
Like my colleagues in both Missouri and Kentucky, Virginia also has strong processes and partnerships in place to manage public health emergencies such as the one being simulated in today's demonstration. The Virginia Department of Health video conferencing system was developed early using bioterrorism funds from the CDC. Our Department of Health has video conferencing capability and trained video conferencing staff in its central office and throughout each of its 35 health district offices since actually September of 2001. Our video conferencing system is used daily for training, meetings, and for emergency communications. The system operates 24/7, and an emergency can be available within minutes, and we had to draw upon this system during the recent hurricane last year, Hurricane Isabel. We'll also be using it during all of our statewide exercises. Our video conferencing network is linked both to our systems at the University of Virginia and here in Richmond at the VCU's health systems. Now, our Department of Health video conferencing network has successfully demonstrated its capacity to support the simultaneous connection of over 40 sites, and we're currently beginning to upgrade it to operate on a lower bandwidth, allowing us to actually even bring more sites on to the system. As chair of the Southern Governors Association, I want to thank the SGA for its leadership role in bringing this effort together. I believe it was initially Governor Sundquist, and then it's been picked up by Governor Holden. And I think this teleconference today demonstrates the fact of the value of having a regional network. If we were to have a public health emergency, these emergencies know no state borders, and the ability for us as state leaders to communicate in a rapid and timely manner with our colleagues at the federal level is critical, and I think demonstrated by this conference, by this test video conference here. You know, we've been using our emergency preparedness and response funds, have been essential in upgrading of our communications center and our communications capability. Virginia will be later participating in Determined Promise 04, which is the large DoD multi-state exercise that will be held in April. We continue to believe that teleconferencing is going to be a critical part of any type of response, albeit to terrorism, to public health emergencies, to natural disasters, and I hope we've been able to demonstrate a little bit of that today, and again want to thank all of my fellow governors and other states from throughout the Southern Governors region for their participation in this effort.
This collaborative project between the Southern Governors Association, state public health agencies, academic medical centers, telehealth networks, and the American Telemedicine Association has been an effort to demonstrate that while we cannot prevent public health emergencies that potentially impact the lives and safety of our citizens, we can employ technology that can greatly improve our ability to respond to them. Today's telehealth technologies make it easier than ever for public health to respond in a real-time and multi-jurisdictional manner. The ability to see, be seen, and discuss critical issues face-to-face during a crisis situation is invaluable. It is the collective hope of those involved in this project that the telehealth networks will continue to expand and the technology will continue to improve so that this form of communication will be available whenever and wherever it is needed.